Morning, everybody. This is Miss Smedley. I'm going to go over my part of the final with you. So let's get started here. This shouldn't take but just a few minutes. I have 12 questions on the adult musculoskeletal. Okay. You want to look at care for the patient with chronic osteomyelitis. Know what the important interventions are for this. Nursing interventions for carpal tunnel. What are your best practices, especially on your medications? Let's see. Assessment of compartment syndrome. You want to know how to detect early onset and prevent any complications that can stem from compartment syndrome. Prioritize post-op care for the below-the-knee amputated patient. Especially, you want to know, make sure that you are well familiar with how to assess that residual limb. Okay. What are the advantages of a fixator over cast for the patient? Such as they ambulate earlier, they can bear more weight, that type of thing. Nursing care for a new fracture. You need to remember with these patients, they do have pain. If you don't stop the pain with an opioid, you're going to do non-pharmacologic like elevating it and all that stuff. Well, if that doesn't work and it is allowed, you can give more opioids if needed. Nursing considerations with administration of bisphosphonate medications. Bisphosphonates, think about it just a little bit. You'll know that they are mostly given to the elderly, and what is the one thing that you need to watch in the elderly with any medication is their urinary output, correct? Okay, pre and post-operative teaching with knee replacement surgeries. You need to know what you need to teach this patient about it, that they will be in a continuous passive motion machine. It will be removed during meals. Who can do what with it. And you also need to make sure that you are well aware of what you can delegate to unlicensed personnel and to the LPN. Rheumatoid arthritis care to increase independence for these patients. You want to make sure that you are familiar with what you can do to ensure that the patient maintains their independence while still providing interventions for them to help with the pain and the disability. Effective teaching on medications for osteoporosis. Know what you need to teach. Basically, the patients who and what you need to teach. Such as you got patients that are going to the nursing home. You don't really teach a nursing home patient about their medications. You help them to understand why they're taking it, but as far as administration considerations, that's more nursing staff that will take that at the nursing home. The same with if you've got someone that's going on home health and has a nurse there every day. The nurse will be doing more of that, more of the educating. You have someone that's going home though with a family member, you're going to want to make sure that you educate both them and the family members. Care consideration for a patient that has a hip arthroplasty. You want to know how to help them feel more independent, more in control of their life. Know the care considerations, legs never crossed, no angle of a 90-degree, should be done on that hip, and those type of things. And it will help you if you will go back and look at that video that I sent you when I did the adult musculoskeletal. Now, I also have 12 questions on the adult GI. So make sure that you go through the care of the patient following an EGD. Remember what we do and what we don't do. They're going to be having Versed through an EGD, so they're going to be sedated somewhat, and this will last for a few hours. They might not be too difficult to arouse, but you will have to arouse them. So, you're not going to give them anything by mouth because they've also had, the back of their throat sprayed and numbed. So you're going to make sure that you've got that gag reflex before you do anything by mouth. Causes for discoloration of stools. You need to know what causes blood discoloration in stools, basically, is what I'm getting at here. What causes, or when you're detecting blood in stool, what causes light colored blood, what causes dark colored blood. Okay? Assessment of GERD. What are the priority assessments for GERDs, especially with someone that is refluxing? What do you need to do? What is your priority care for them? Care considerations for a patient with a rolling hernia. What is that priority care that you need to give a patient that has a rolling hernia? And what do you need to assess for? A patient teaching post-Nissen fundoplication for GERD. Know what you need to teach your patient about the procedure, and also, what to expect later on. Nissen fundoplication is not a cure. Okay, it just helps to control the GERD. It does not cure the GERD. Care for NG tube, and you need to know specifically how to assess for complications with the NG tube. Care for complications with peptic ulcer disease. What do you need to do for patients that are exhibiting complications such as vomiting or a blood in a stool? What is the priority care that you need to do for that? Like, you're going to prevent aspiration. You're going to make sure that their H&Hs are not low. If they are, they're going to have some blood, that type of stuff. Okay? Assessment of unguenal hernias. How is commonly identified? In other words, you're the nurse that's doing an assessment, and what do you see that says to you, hey, that's an unguenal hernia? Okay? Care for mechanical bowel obstruction. What do you need to do to care for this patient? Okay? Colostomy care and teaching. What are you going to teach your patient about their care? And specifically, what are you going to teach them about the stools? Stools have different characteristics coming from different spots in the colon, so make sure that you understand that. And our final one is assessment of Crohn's disease exacerbation. What are expected findings that you will see on someone that is coming in with Crohn's disease that is exacerbated? And then there is one more that is not on here, but it has to do with the dosage calculation. I hope this helps you, and if you have any questions or any concerns, please feel free to contact me here at the school. And I wish you luck and a good summer. Goodbye.